to Getting Your Money's Worth, the show that focuses on value. I'm Judith West, and our guest today is Ruth Finkelstein, Vice President of Health Policy for the New York Academy of Medicine. Hi, Ruth. Thanks for being on the show.
Thanks for having me.
Okay, so tell me something. I've been in New York for a long time. I never heard of the New York Academy of Medicine before. What's wrong with me?
Well,
What is your mission?
our mission is to improve the health of the public. And we've been doing that since 1847.
No wonder New Yorkers are so healthy.
We are, in
Yes,
fact,
actually, by
healthier
Ruth,
than,
we are healthier than,
Right.
than the national average. Yeah.
That's exactly right.
Well, they have someone like you in their corner.
Oh, thank you so much.
But you have a particular demography that you work with.
Well, we have a number of key focus areas. One is to create environments that support healthy aging, and that's what I think we're going to talk more
Exactly.
about today.
Yeah.
But also, we work hard to create systems to prevent disease and to promote
Well,
health.
we'll talk about that also. Let me say something. Your population, in terms of promoting healthy aging, and I use that word, loosely, your population has boomed.
Oh, it's
I mean, you
booming.
guys must be very busy.
We are very busy, and we're anticipating being even busier because
You have all these baby boomers now.
That's exactly right. Over the next 10 years,
Yeah.
there's going to be almost 50% more older adults than there are now in New York City.
Now, New York City, recently I read in the New York Times, was branded as a city very favorable for aging citizens.
It's true.
I think you guys had a part to do with that branding, right?
It's true.
Right.
We call it an age-friendly New York City, and the mayor's added a city for all ages into that title. And think about the various advantages
I was going
of
to
New
say,
York City.
what makes New York City advantageous for the aging?
First of all, we have a wonderful public transit system. And even though the subway, there's a lot of stairs to go up and down, the bus system is built to be accessible to older adults.
And is very accessible.
And it's very accessible
I'm going to tell
with
you
the kneeling
something.
buses.
I had an accident recently that has me using a walker right now. And very often when I'm on the bus, I'm very impatient when the thing goes down and it takes so much time. Well, let me tell you something. Never again. I am going to be very appreciative of the fact that the bus is so accessible for folks that have some kind of physical handicap.
That's right. And then, should you not be able to use the bus, that system is augmented by yet another system called Accessoride.
Oh, tell us about Accessoride.
Well,
I see those on the road.
These are vans that you can call and that pick you up literally at your door and take you to where you're going.
Really?
So,
is that a public service?
It's a public service. You have to be deemed eligible for Accessoride, but the eligibility criteria really have to do with you need the service.
Right.
So, the way that you become eligible for Accessoride is to show that you're older and that you need assistance with transportation services, and it's improving all the time. And one of the improvements to Accessoride is actually a simplification to just give people taxi vouchers.
Oh, that's an interesting.
Isn't that great?
It's very great. Do these things have income limits?
Neither of those services have income limits.
Oh, good. Yeah. Okay. So we get that. I understand that. What else are you doing?
Well,
that's a big
other
part.
ways that the city is age-friendly are the amazing cultural and service opportunities here, right? And then the third way, and in some ways it's where I should have started, is that we're a city of neighborhoods. New York, you think of it, it's such a big city. But in fact, we live in our neighborhoods. And the neighborhoods are mixed use. Right? Which means there's retail, and there's housing, and there's recreation.
And there's a park if you're lucky.
And there's a park if you're lucky, and more parks.
Yeah.
And those are exactly the kinds of neighborhoods that people are planning and building all over the country. And that's what we're made of here.
Ruth, I don't know if you do anything on this, but do you have any programs, or are you working on anything on making folks that are retired, that maybe live alone, feel useful to society?
Well,
as I look around, I see that, especially as more and more people are living older, I see that as a terrible void in society.
Well, in the framework that we use, which is developed by the World Health Organization, we call that civic engagement and
I like
social
that.
participation.
I like that.
And it's one of the things that people around the city, older adults, told us they're the most hungry for.
Exactly.
And there are lots of opportunities for people to be connected and
So
engaged.
how do they find out about these opportunities?
That's where the rub is, okay? Because there's a lot of opportunities, but there's not good information and communication about those opportunities. And that's one of the things that we're working with this Commission for an Age-Friendly New York and with city government and city council about how do these opportunities get communicated to people more effectively. Because one of the things we learned is that older adults use kind of more local means of communication and getting information.
Well,
so,
I suppose they're having,
you know, so that people tend to see things on bulletin boards and local newspapers.
Or somebody
and
tells
them and word of mouth more so than in the
maybe some of those things should be posted on bulletin boards in doctors' offices.
Well, that's one of the things, and also in some of the businesses that all older adults use, like banks and pharmacies and grocery stores. And that's one of the things that we're doing is to work with businesses about how do you be age-friendly. And one of the simple things to do is have a bulletin board.
Exactly.
Have an information
and even
place.
Or having, you know, something. I saw you're working on having people being able to get a drink of water when they want
Exactly.
it. I mean,
Exactly.
Simple, practical, pragmatic things.
Exactly. And we're finding that businesses are really receptive because of course they're interested in this
and also
population.
many of these folks, frankly, they're the people that have some money to spend these days.
Well, exactly.
And also they're often very eager to spend money for their children and or their grandchildren.
And loyal.
And loyal. So if anything, I mean, if a business wants to develop a loyal consumer that has money, that's a very fertile population.
Exactly. Yeah. And we're finding that people are really receptive to learning how to be age-friendly.
What are you doing about nutrition and or which leads to malnutrition, or the other side of the coin, obesity?
Well,
you talk about preventive.
Right. Yeah. There's a whole range, there's a whole spectrum of activities. One of them is that access to healthy food is really important for everybody. It's really important for older adults, and there's more barriers to that accessibility because people don't want to travel as far and carry food as far.
I have to tell you something. When this little accident happened to me, I was transferred to an acute rehabilitation center, a very good repute. I couldn't, and they came every week, every day they came and asked me what I wanted from my menu, what I wanted to eat. I couldn't get over my choices. Hot turkey sandwich with mashed potatoes and gravy.
Who wants to eat
apple
that?
cobbler or blueberry cobbler. Here I am lying in a bed, and I see in the physical therapy, I see people who are clearly overweight, and I'm thinking, where is the sense not to offer nutrition, health? I go into hospitals if I'm visiting somebody. I don't go. I see in the cafeteria there are rarely healthy food choices.
Right.
What's wrong?
Well, that's a whole nother initiative, and actually, your observation is being made by a number of people. The Centers for Disease Control and other organizations are starting to focus on what are our institutional food choices? And that's one of the things that we're working on. We have a new statewide center, DASH New York, that is obesity prevention policies. We're looking at all different aspects of the social, built, and food environment to think about what are the food policies, the transportation policies, economic development, and land use policies that promote or don't promote healthy eating. And when you look at all the institutional settings, hospitals are an obvious one, schools are another, all the senior centers or yet another.
Yes, right.
You look at all those things taken together and you say, well, if we improved the healthfulness of the choices in all those settings, we would really start making a difference on what people had to eat over the course of a day.
Exactly, and also on how they age.
Right, and what people think of as a good idea for a lunch or a dinner or a breakfast.
Yeah, I have to ask you this.
Yes.
How young do you have to be considered aging?
Well, you know,
do you guys have a cutoff in your all your work?
Well, you know, it's different for different reasons because you really, you know, all the expressions how 40's the new, or 50's the new 40 and 30's the new 20.
You know what?
But
I don't know if people believe that.
Right. But here's what's true. How old you are determines your eligibility for various benefits and government programs. So which sort of arena you're working in, what's the age cutoff depends on the arena. So right now, 65 is a big cutoff
is
point
that still,
because that is Social Security and Medicare eligibility.
Right.
But senior centers and those things funded through the Older Americans Act, the cutoff is actually 60. And of course, in the debates about Social Security, one of the things that's being talked about is raising the retirement age. So we may see in our lifetime where the age where you're considered old because you're eligible for retirement actually goes up.
And as truth of the matter is, I think people are aging better. You know, we spend a lot of time, we don't have a lot of time, it's a couple minutes, we spend a lot of time talking about the physicality of and sometimes about the mental attitude, the loneliness factor.
Yes. Well, social isolation
social
is one of the biggest risks.
One of the biggest risks, and also one of the biggest precursor almost to not
aging
healthy.
Right. Social participation, community cohesion, staying active and integrated into a social network is the single most important thing you can do. That and go for a walk.
And go for a walk.
Are the
well,
best.
Going for a walk is absolutely right. But I think you talked about that with these community boards. And honestly, I think folks there's other little things that I read about in your talking points that I saw, like traffic lights maybe that blink too fast.
Right.
I love that you're having conversations about having some public restrooms. That are
right.
All those things you don't realize the need for them until you need them.
Exactly right. And they're all barriers to people being able to be out and about and socially
In fact,
active.
I just read one, we only have a second left, where folks are afraid on sidewalks because of bikes.
Because of bikes, and because of bumps, because of potholes,
right. So
it's a whole range of
all
things.
The things that we read about and wonder about, no matter what stage of your life, either if you're not age 65, you're going to be, and if not, you're a family member. Those are all things that impact the people that all of us should be concerned about.
Exactly right, and they're all the components of an age-friendly city.
Well, thanks for what you do. I'm very happy to have you on the show, and hope that you'll let us do other things for you as you go forward. This is a very good topic for getting your money's worth.
Wonderful.
After all, there's a huge
forward
segment of society that we should be getting some feedback from.
Exactly right, and having actively participated
in society. Right.
Exactly
Thanks again for being on this show.
Thank you.
You're watching Getting Your Money's Worth. Thanks for watching.